Vomiting and diarrhea are common childhood illnesses. They can occur separately or at the same time. Diarrhea is an unusual increase in the number of stools or bowel movements per day, or an increase in the looseness or amount of water in the stool. Diarrhea is most commonly caused by a viral infection or the intestinal tract. However, infants and young children can have more frequent or more loose stool for other reasons, including viral upper respiratory infections, or inability to digest certain foods, or drinking too much juice.
Diarrhea caused by an intestinal virus usually clears up after 5 to 7 days. The treatment of vomiting and diarrhea is aimed at preventing your child from becoming dehydrated while he or she naturally recovers from the infection. Antibiotics are not helpful in treating virus-caused diarrhea. Other medicines such as kaopectate or Lamotil, medicines which will slow down the diarrhea, can make the infection last longer and make your child more ill.
Frequently vomiting and diarrhea occur together. Treat the vomiting first and then follow the instructions for diarrhea.
Do not give any fluids, including water or solids, for 2 to 4 hours after the last episode of vomiting. This is important. After the initial 2 to 4 hours of stomach rest, start clear liquids very slowly. For infants, use Pedialyte, ½ ounce, every 20 minutes. For toddlers, 1 ounce of Pedialyte or Gatorade. For older children, Gatorade, popsicles, flat pop, and soup broth. Repeat the small amount every 20 minutes. If your child keeps the liquid down after the first hour, double the amount and continue offering every 20 to 30 minutes. You can continue to double the amount every hour. If your child starts vomiting again, wait an additional 2 to 4 hours and try again. If this fails, please call CMG or Children's Medical Group.
Trying to hurry the process by offering your child liquids or solids too soon or too much will only cause the vomiting to return.
Once your child has kept liquids down for about 4 hours, you may start bland foods. These include things like crackers, cereal, toast, rice, non-citrus fruits like bananas and apples or applesauce, mashed potatoes, spaghetti, vegetables, and soup. It's best to give smaller amounts more frequently. After 2 to 4 hours of keeping down bland foods, your child may return to a regular diet. This includes milk products.
The main goal of treatment is to keep your child well hydrated. This can best be accomplished by adjusting your child's diet.
For breastfed infants, continue breastfeeding and give your baby extra liquids. These can be things like Pedialyte and juice. Regarding other infants and children, if your child is vomiting, follow the vomiting guidelines first. You'll want to treat the vomiting before the diarrhea. The current recommendation for treatment of diarrhea is to continue giving solid foods and to offer additional liquids. The best fluid to prevent dehydration is Pedialyte. Gatorade can be substituted for toddlers and older children. If your child has blood or mucus in their stool, please call Children's Medical Group. For most children with diarrhea, stopping milk products is not necessary. Foods like bananas, rice cereal, applesauce, toast, boiled rice or spaghetti, cooked carrots, crackers, and cereal will help stools firm up quicker. If the diarrhea lasts longer than 7 days, please call Children's Medical Group.
The major problem with vomiting and diarrhea is dehydration. This happens when someone loses more fluids than he or she takes in. If your child develops signs of dehydration, he or she needs to be seen at Children's Medical Group.
When determining if they are dehydrated, please look for these signs. including dry tongue, lips, and inner cheek, no tears when crying, no urine for 10 to 12 hours, sunken eyeballs or fontanelle, also known as the soft spot. Also, the child becomes very sleepy. We call this being listless. Diaper rash from diarrhea. When stool contacts the skin can become irritated and red. As you might expect, when an infant or young child has diarrhea, a skin rash frequently develops on the child's buttocks. To protect their skin, wash it after each bowel movement, pat dry it well, and cover it with a thick layer of Vaseline or A&D ointment. This protection is especially important at night or during naps when diapers are changed less often. Call Children's Medical Group if your baby's bottom is developing raised, red spots or blisters.